As a physiotherapist working with back patients every day, as we run a back center here in Belgium, I know that the Mastercare backtraction is perfect to treat a lot, or say most of all, back problems. It's not difficult to explain why. We know that it's a condition of our disc being most responsible for a good functioning segment. That means that if the amount of fluid within the disc is decreasing, the distance between the vertebrae is decreasing. Stability is getting lost and nerves can get pinched. This might be because there are not enough recuperation possibilities or because there's a bad circulation within the surrounding tissue. Later studies prove that most back complaints are caused by this instability of the spine. On the Mastercare device, we find that due to its moving backrest with an inclination of 15 degrees, the traction force is big enough to effect a structural change at the spinal segment, because the moving backrest eliminates the friction. Now, this 15 degrees we work in is a very comfortable position and can be safely used for nearly all patients, despite age or weight. Patients are able to relax in this position and muscle tension and pain will decrease quite fast. This 15-degree inclination position also permits us to combine traction with other useful manual techniques, mobilizations and/or manipulations or other soft tissue techniques. So as for instance in most cases of nuclear protrusion or prolapse, where we can use the Mackenzie principles under traction, the extension exercises. The moving backrest also permits us to do some more exercises to relieve pressure on the joints and realign the pelvis with a few simple stretching movements as to increase mobility. When we're able to let our patient relax, sometimes move, separate or realign the segment in such a way as to relieve impingement, when we're able to increase mobility, a third and important step is to start as soon as possible with the stabilization of pelvis and lumbar segments. When working on the table, we have the advantage of working in a non-loaded, realigned position. So we can start in a very early stage with stabilization training to increase the muscle balance. We also experienced that under traction, when the global muscle system, the large and more superficial muscles of the trunk, are stretched, think of external oblique and the erector spinae, the inhibition towards the local muscles, including deep muscles such as transversus abdominis and the lumbar multifidi that are attached to the lumbar vertebrae and sacrum and are capable of directly controlling the lumbar segment, well, this inhibition is far less under traction than normal, which implicates that it's much easier to activate these deep muscles. The active co-contraction of these muscles is completed at a very low level of muscle activity and is forming a deep muscle corset or performing self-bracing, which is very important to prevent relapse. It's a combination of traction, mobilization and stabilization in a very early stage that we use on a Mastercare backtraction. In fact, a multidisciplinary treatment, and which was the subject of a small study we did at the beginning of 2003. The results of this small study were quite encouraging, as in a group of chronic low back patients treated daily on a Mastercare backtraction during 2 weeks, the average of VAS scales, the pain scales, before treatment decreased with more than 50% after treatment. Also, Oswestry index, the functional status, showed the same positive results. We surely found a statistically significant change. As for patient's position, prone or supine, as both positions are possible on the table, it's our experience that prone position is a much more comfortable position for most back patients. The ability to use the Mastercare backtraction in this position is certainly a big advantage. Prone position on the Mastercare backtraction is not comparable with prone position on a common massage table or bed. The construction of the table allows knees and hips to stay in slight flexion during traction. The use of support pillows allows us to flex the hips even more to facilitate lumbar traction by flattening the lumbar spine. Also, when stepping into and out of the Mastercare backtraction, especially when there are disc problems involved, prone position shows to be a better position, because we keep the neutral pelvic position, avoiding flexion of the lumbar spine when stepping out. Is it thought for one or another reason impossible to put a patient on the stomach? Then certainly use the knee support for the initial treatments. Working on a mastercare backtraction means you get a fast relaxation, decreasing of pain and muscle spasm, increase mobility, that you will increase circulation and nutrition towards the disc and joints. You get a fast rehydration of the disc. You get a postural correction and realignment of pelvic and spine. And the biggest advantage is that you can start stabilization training in a very early stage, increasing muscle balance and power in an unloaded position. At our back center, we use the mastercare device for nuclear disc protrusions, chronic low back patients, posterior dysfunction syndrome, lumbogluteal pain with prolonged restriction of straight leg raise, nerve compressions as long as they are mechanical, recurrence after laminectomy, arthrodesis, primary posterolateral protrusions and anterolisthesis. I would surely recommend this device to anyone who wants to help people with back complaints.